The state's Ministry of Health has officially announced a new COVID-19 case, sparking a swift activation of the state's emergency response and alert members of the public to be wary of COVID crowded gatherings and observe COVID-19 protocols to avoid transmission. The Commissioner for Health, Dr. Henry Ayuk, announced this in Calabar following a new case in the state. The report.
The Commissioner for Health, Dr. Henry Ayuk, said there is no cause for alarm despite the identified case, noting that the patient, a Chinese national working with Lafarge in Akampa, reportedly entered the country a month ago. Ayuk said from a risk management standpoint, the state remains safe and the situation has been managed effectively. Ayuk explained that after testing positive, the individual was immediately moved to the state-designated isolation center, maintaining that there is no cause for alarm as the identified case has already been quarantined according to established protocols. Despite reassurance, the state is not taking any chances. Commissioner Ayuk confirmed that the Public Health Emergency Operations Center has been activated and a rapid response team already deployed to Akampa to monitor the site and prevent further transmission.
So there's no alarm. A few days ago, about 3-4 days ago, we had a case of COVID-19 that had been confirmed. In the show that the processes involved with identifying and confirming every case of COVID-19 have been done. The protocols have been followed and it's confirmed. I would not like to announce something that it is not there. They discovered that it's not there. So we have a positive case, a Chinese that flew into the country exactly a month ago, and he works with Lafarge here in Akampa local government, in Famosing area. That case was reported first in terms of, it has, the man about 53 years or so, had symptoms that were treated silently. Today, the case is still being managed at our center that is dedicated to the state. And he's doing well in terms of the clinical improvement. He's improving. We've activated our Public Health Emergency Operations Center in the state. We have deployed our rapid response teams to the local governments to Akampa. So Cross River is safe from the point of view of our risk management, where there is no point to be alarmed. The governor is at the forefront of a people first mantra.
The state epidemiologist, Dr. Blessing Nyang, said COVID-19 is still much around and the state has already initiated intensive contact tracing to stem any potential spreading, calling on members of the public to remain alert and observe all preventive measures to stay safe.
So COVID-19 is caused by SARS-CoV-19 virus, and it have the symptoms of fever, chills, sore throat, cough, and catarrh. In severe cases, the respiratory system is compromised, where the person may have difficulty in breathing. So most cases they are all mild cases. That is why we have not been hearing about it. But I want to say that COVID-19 is still with us. So we urge everybody to send out positive information, positive message that will stem the spread.
Sunday Ina, Service News.